Welcome to another episode from the Veterinary Medicine Digest. Today, we are immersing ourselves in one of the most pressing health challenges facing modern society and our animal companions alike, obesity in dogs. This is not merely a cosmetic concern, it is a global, escalating disease with profound implications for longevity and quality of life. The discussion around obesity provides a compelling platform for the One Health framework. This concept recognizes the deeply interconnected nature of the health of people and small companion animals, who increasingly share environments and lifestyles. This shared existence, while enriching, carries a myriad of health implications, contributing to high rates of conditions such as cardiovascular disease, type 2 diabetes mellitus, and specific cancers across both species. Because obesity is a major healthcare problem showing an increasing prevalence in both human and veterinary medicine, it serves as an excellent candidate for a collaborative One Health approach. By adopting this perspective, we encourage coordinated and collaborative action among veterinary and human healthcare professionals to address shared health problems effectively. Defining and measuring the canine conundrum. At its core, obesity is defined as the accumulation of excess body fat. However, diagnosing an overweight state or outright obesity in companion animals is complicated because body composition naturally varies widely across species, breeds, and ages. The most relied upon clinical method for assessment is the body condition score, often abbreviated as BCS. This is a subjective and semi-quantitative technique that uses both visual inspection and tactile assessment, involving palpation of the waist, the rib cage, and the dorsal spinous processes to estimate a dog's fat reserves. The veterinary standard largely employs a 9-point scale. On this 9-point scale, dogs achieving a score of 6 or 7 out of 9 are typically classified as overweight, while those scoring 8 or 9 out of 9 are designated as obese. To put this in perspective, a dog earning a body condition score of 7 is estimated to be approximately 20% over its ideal body weight, and its body composition includes a predicted 30% body fat. Generally speaking, obesity is functionally defined as possessing greater than 40% body fat, while being overweight means having greater than 20% body fat. Although alternative assessment methods exist, such as dimensional evaluation and body mass index, the high variability among canine breeds makes the subjective body condition score system the most widely adopted practical clinical tool. The prevalence and escalation of canine obesity. The scope of canine obesity is immense and alarming. Global estimates regarding the prevalence of overweight and obesity in the dog population exhibit a wide range, spanning from about 19.7% up to 59.3%. These figures reflect a dangerous trend, mirroring the relentless rise in human obesity rates. A significant, decade-long retrospective study conducted at a large veterinary teaching hospital in the United States, analyzing over 40,000 dogs between 2006 and 2015, found the overall prevalence of combined overweight and obesity to be 41.3%. This total was split between 21.1% categorized as overweight and 20.2% categorized as obese. Interestingly, when comparing this finding to a prior study conducted in the same facility, 1999 to 2004, the overall combined prevalence remained largely static, 40.0%. However, closer inspection reveals that the prevalence of obesity specifically appears to have increased during the more recent period, a finding that warrants careful monitoring and further investigation. Despite the undeniable clinical impact of obesity, the authors of that large study noted an important discrepancy. In dogs identified as having an elevated body condition score, obesity was not consistently recorded as a formal diagnosis in the medical records, suggesting that this pervasive health issue remains under-recognized or under-prioritized by some veterinary professionals. The complex tapestry of risk factors. Obesity is categorized as a complex disorder resulting from the intricate interaction of numerous elements, including genetics, environment, metabolism, the microbiome, and shared lifestyle and socioeconomic factors. Signalment and demographics. Several intrinsic characteristics make a dog more susceptible to weight gain. 1. Age and sex. Dogs categorized as middle-aged or senior carry an increased risk for becoming overweight or obese. This aligns with studies showing that obesity frequency is highest in dogs aged 6 to 10 years, a tendency that decreases past 10 years of age. Middle-aged neutered female dogs are particularly highlighted as the group most likely to be overweight or obese. This age-related risk is likely due to the natural decrease in activity levels and corresponding reduction in energy expenditure associated with aging, which can lead to weight gain even if caloric intake is steady. 2. Neutering status. Sterilization is consistently identified as a significant risk factor. The heightened risk associated with neutering results from a dual biological challenge, a measurable decrease in the dog's energy requirements needed to maintain its ideal body condition, coupled with an unfortunate increase in food consumption, especially when animals are allowed to eat freely or ad libitum. This emphasizes the critical need for detailed nutritional management plans to prevent unintentional weight gain following the procedure. In fact, one large study demonstrated that intact dogs were significantly less likely to be overweight or obese compared to their neutered counterparts. Environmental and human-related factors. The close lifestyle shared between people and pets means that human habits directly influence canine health. Dietary habits. High-fat diets are closely associated with obesity in dogs. Furthermore, studies have documented a link between obesity and the practice of providing an increased number of snacks and meals, the feeding of fresh meat, commercial treats, and human kitchen or table scraps. One study even indicated that owners of obese dogs were more likely to prioritize inexpensive pet foods. Activity levels. Reduced daily exercise is strongly associated with obesity. Owner behavior is key here. Owners of overweight or obese dogs are generally less likely to engage in regular exercise themselves. Conversely, dog owners who have greater access to parks and natural reserves often report higher levels of social support from family for walking and engaging in physical activity, suggesting environmental access and social support are important protective factors. The power of genetics. Genetics exert a powerful and measurable influence on obesity susceptibility in dogs. Certain breeds, notably Labrador retrievers and golden retrievers, show a significantly higher predisposition to obesity. A major breakthrough in understanding this genetic link involved the pro-opiomelanocortin gene, or POMC. A deletion mutation in this gene, referred to as POMCP.P187FS, is associated with an increased appetite, higher adiposity, and greater overall weight in both Labrador retrievers and flat-coated retrievers. This single, high-impact mutation is present in about a quarter of pet Labrador retrievers. Going deeper into the genetic architecture, a recent genome-wide association study, or GWAS, performed on Labrador retrievers identified multiple genetic locations associated with obesity. The most significant finding linked obesity to a region within the gene known as DENN domain containing 1V, or DENND1V. This finding powerfully illustrates the value of using comparative genomics. The same canine obesity genes identified in this study were also found to be associated with both rare and common forms of obesity in humans. Specifically, each copy of the risk allele of the variant associated with DENND1 conferred approximately 7.5% greater body fat in the dogs studied. The function of DENND1 provides a mechanistic link to appetite control. This gene encodes a protein that acts as a guanine nucleotide exchange factor, which is involved in a process called clathrin-mediated endocytosis. This process essentially helps regulate the activity of cell surface receptors. Researchers demonstrated that DENND1 promotes the internalization of the melanocortin-4 receptor, or MC4R, a critical control point for energy homeostasis located in the hypothalamus. When this receptor is internalized, it is deactivated, reducing the downstream appetite-suppressing signal, or CAMP signaling. Therefore, increased DENND1 activity promotes MC4R internalization, thereby reducing the anorexigenic or appetite-diminishing signal, resulting in increased obesity risk. This discovery of DENND1 as a regulator of the MC4R signaling pathway enhances our comprehension of this critical pathway in regulating energy homeostasis, with relevance for both dogs and humans. To quantify the total inherited risk, researchers created a polygenic risk score, or PRS, using 16 genetic variants associated with obesity. This PRS was effective at predicting body condition score and body weight in an independent population of Labrador retrievers. Furthermore, this polygenic risk score directly correlated with the dog's food motivation score, indicating that the genetic risk is significantly mediated by a greater inherent appetite. This phenomenon has practical implications. Dogs with higher polygenic risk scores were found to be more prevalent in Labrador populations selected to be assistance dogs. This suggests that breeders may inadvertently select dogs with a high food drive because they are easier to train using food as a positive reinforcement tool, ultimately promoting the transmission of obesity-promoting genetic variants. Most importantly, the research demonstrated a crucial gene-environment interaction. Dogs identified with a low polygenic risk largely remained at a normal weight, regardless of owner control over diet and exercise, suggesting a strong resistance to becoming overweight. However, for dogs possessing a high polygenic risk, strict owner control of diet and exercise significantly reduced their body condition score, p-value 0.0077. This compelling finding proves that even significant genetic risk can be successfully mitigated and managed through dedicated intervention and a non-permissive environment. The grave health consequences of excess adiposity. Obesity is linked to a shorter median lifespan and substantially impairs the quality of life in affected dogs. For example, studies in Labrador retrievers showed that moderate obesity reduces life expectancy by almost 2 years. Overweight and obesity are associated with a myriad of concurrent conditions including neoplasia, orthopedic diseases, and endocrine issues. Metabolic dysfunction. The canine metabolic syndrome? Given the strong association between obesity and metabolic syndrome in humans, researchers in veterinary medicine developed a modified framework to define a similar state in dogs, calling it obesity-related metabolic dysfunction, or ORMD. The diagnosis of ORMD requires a dog to have a body condition score of 7 to 9 out of 9, along with the presence of any two of the following 4 criteria. 1. Triglycerides greater than 200 milligrams per deciliter. 2. Total cholesterol greater than 300 milligrams per deciliter. 3. Systolic blood pressure greater than 160 millimeters of mercury. 4. Fasting plasma glucose greater than 100 milligrams per deciliter, or a previous diagnosis of type 2 diabetes mellitus. Using these criteria, approximately 20% of obese dogs studied were classified as suffering from ORMD. Another study suggested this prevalence might be as high as up to a third of obese dogs. Notably, the presence of ORMD was not correlated with the dog's total fat mass, as measured by dual-energy X-ray absorptiometry, a finding similar to the concept of metabolically healthy obese individuals in human medicine. The presence of ORMD was characterized by 2 major physiological shifts. 1. Hyperinsulinemia. Increased plasma insulin concentration was significantly greater in ORMD dogs, approximately 2-fold greater, compared to obese dogs without the condition. 2. Hypoadiponectinemia. Decreased plasma adiponectin concentration was significantly lower in ORMD dogs, approximately 2-fold less, and showed a negative correlation with plasma insulin. Adiponectin is a metabolically active hormone secreted by fat tissue that typically promotes insulin sensitivity and glucose uptake. These metabolic findings imply serious physiological consequences, including insulin resistance. Diabetes mellitus, a species difference. A key distinction between canine and human/feline obesity is the link to diabetes. While obesity is a major risk factor for type 2 diabetes mellitus in people and cats, this strong association is generally not recognized in dogs. The vast majority of diabetic dogs suffer from type 1 diabetes, which involves the destruction or loss of insulin-producing pancreatic cells. Because canine diabetes is predominantly type 1, obesity does not typically cause the disease. However, obesity does undeniably decrease insulin sensitivity in dogs, which can significantly complicate the management and control of existing diabetes. Differences in the adiponectin response in dogs compared with cats and people are speculated to contribute to the lower prevalence of type 2 diabetes in the canine species. Cardiovascular impairment. The cardiac effects of obesity are a grave concern, as increased body fat mass raises both the cardiac preload, blood volume returning to the heart, and afterload, resistance the heart must pump against, impacting both heart structure and function. Studies show that obesity leads to cardiac remodeling in dogs. Specifically, this involves left ventricular hypertrophy, characterized by increased left ventricular wall thickness. This hypertrophy is considered multifactorial, potentially stemming from the chronic volume overload induced by higher blood volume, coupled with increased peripheral resistance and potential systemic hypertension. Furthermore, obesity has been linked to diastolic dysfunction, which refers to the heart muscle's impaired ability to relax and fill correctly. In one cohort of obese dogs studied prior to weight reduction, evidence of impaired relaxation was observed in all assessed patients. The development of diastolic dysfunction is complex, linked to factors like the accumulation of fat, triglycerides. In heart muscle cells, the activation of the renin-angiotensin-aldosterone system, and elevated inflammatory cytokines, all contributing to increased myocardial stiffness. Systolic dysfunction, The impairment of the heart's ability to pump blood out was observed less frequently. Hypertension, direct effect or comorbidity. The relationship between obesity and high blood pressure or systemic hypertension, defined as persistent systolic blood pressure greater than 160 millimeters of mercury, is complex and debated in dogs. Some studies observed mildly elevated systolic blood pressure in many obese dogs prior to weight reduction, noting that nearly 60% of dogs in one cohort had systolic blood pressure exceeding 160 millimeters of mercury upon enrollment. This led some researchers to suggest that obesity itself increases blood pressure. However, other comprehensive studies suggest that obesity is not an independent risk factor for systemic hypertension in dogs. These studies found no significant difference in blood pressure values between obese and non-obese dogs. They concluded that when hypertension is observed in obese patients, it is typically attributable to concurrent, pre-existing comorbidities such as chronic kidney disease, certain endocrinopathies, like hyperadrenocorticism or diabetes mellitus, or cardiopathies, all of which have their own established pathophysiological mechanisms that lead to hypertension. The increased systolic blood pressure observed in clinical settings might often be a consequence of situational hypertension, commonly referred to as the white coat syndrome, induced by the stress of the hospital environment. Orthopedic, pancreatic, and renal issues. Orthopedic disease. Excess weight places tremendous additional stress on weight-bearing joints, making orthopedic diseases highly associated with obesity. Beyond mechanical stress, adipose tissue itself releases pro-inflammatory cytokines, which are implicated in promoting arthritis, even in non-weight-bearing joints in obese individuals. Therefore, maintaining ideal body condition is a primary recommendation for both prevention and management of orthopedic diseases in overweight dogs. Pancreatitis. Obesity increases the risk of pancreatitis in dogs. Adipokines, hormones secreted by fat tissue, are involved in the pathology. In dogs suffering from acute pancreatitis, serum concentrations of the adipokines leptin, resistin, and visfitin were found to be significantly higher than in healthy dogs, while the protective adipokine adiponectin was significantly lower. These findings suggest that adipokines may play a modulating role in the development of acute pancreatitis in dogs. Renal function. Basal glucosuria. Interestingly, though not directly a comorbidity, researchers studying renal function observed that minute amounts of glucose, referred to as basal glucosuria or normoglucuria, are detectable in virtually all canine urine samples, 99.1% of samples analyzed, when using highly sensitive wet chemistry methods. This finding contradicts the old paradigm that urine is glucose-free unless the high renal threshold is exceeded. Notably, this basal glucose excretion was found to be statistically unaffected by the dog's obesity status, age, sex, or feeding status. The role of leptin and inflammation. Leptin is a key metabolic molecule, an adipokine, whose production is primarily based on secretion from fat cells. Its level correlates directly with the mass of white adipose tissue. Leptin is crucial for energy homeostasis, acting on the hypothalamus to decrease food intake and increase metabolism. However, obesity leads to hyperleptinemia, high circulating leptin, and often leptin resistance. Leptin is considered a pro-inflammatory adipokine. Obesity creates a chronic, complex pathological state associated with multiple systemic alterations, largely driven by the dysregulation of adipokines. Immune modulation. Leptin possesses structural similarities to the cytokine family, and its receptor belongs to the class 1 cytokine receptor superfamily, meaning it has profound modulatory effects on both innate and adaptive immunity. High concentrations of leptin are associated with insulin resistance in dogs. Elevated leptin concentrations are also implicated in promoting carcinogenesis, particularly in canine mammary carcinoma. Cardiovascular link. High circulating leptin levels are associated with cardiac dysfunction and heart failure in dogs. Leptin regulates the heart's baseline physiology, including myocyte contractility, hypertrophy, apoptosis, and metabolism. In cardiac disease and congestive heart failure, leptin significantly increases, potentially due to elevated catecholamines and pro-inflammatory cytokines, suggesting it acts as a predictor of cardiovascular morbidity. Weight loss in obese dogs successfully decreases leptin concentrations. Neoplasia and cancer. The connection between obesity and neoplastic diseases is complex. Neoplasia was the most frequent concurrent disease categorization found in a large retrospective study of obese dogs at a veterinary teaching hospital. Although the direct link between obesity and cancer risk is not as strongly defined in veterinary medicine as it is in human medicine, Obesity has been described in association with an increased risk of bladder cancer in dogs living in households where lawn chemicals were used. This risk was higher in obese dogs, potentially linked to the fat solubility of the chemical exposures. Furthermore, leptin and other components of obesity, such as decreased adiponectin expression and increased leptin levels, are implicated in promoting carcinogenesis, tumor growth, and metastasis, particularly in canine mammary carcinoma. Macrophage infiltration of tumor areas appears higher in overweight or obese subjects, and increased macrophage numbers coupled with decreased adiponectin associate with a poor prognosis and high histological grade in mammary carcinoma. The path to wellness, management, and reversal. The good news is that the pervasive health issues caused by obesity are often reversible through dedicated intervention and successful weight loss. A successful weight reduction program is fundamentally designed to maximize the loss of fat mass while meticulously minimizing the loss of lean tissue mass. Weight management regimens typically combine dietary restriction, often utilizing high-protein and high-fiber formulated therapeutic diets, with individualized counseling on activity modification and lifestyle changes. Food allocation is highly tailored, typically restricting the dog's energy intake to 50 to 60% of the estimated maintenance energy requirement calculated for their ideal target weight. In one study, dogs completing a successful weight loss program achieved a median weight reduction of 23% of their starting weight over a median duration of 224 days. This weight loss resulted in a profound and positive shift in metabolic and cardiovascular health markers. Metabolic and hormonal reversals. Weight loss successfully reversed the characteristic abnormalities of obesity-related metabolic dysfunction. Specifically, metabolic markers. Successful weight reduction led to a significant decrease in systolic blood pressure, as well as reduced plasma concentrations of cholesterol and triglycerides. Plasma insulin concentrations also significantly decreased. Adipokine correction. Crucially, the beneficial hormone plasma adiponectin concentration significantly increased following weight loss, while concentrations of the inflammation-associated hormone leptin decreased. These findings confirm that a weight loss program effectively alleviates the hyperinsulinemia and hypoadiponectinemia that define ORMD. Cardiovascular remodeling. Weight reduction also yielded significant positive changes in heart structure. The left ventricular hypertrophy associated with obesity proved to be, at least in part, reversible. Weight loss resulted in a statistically significant decrease in the systolic thickness of both the interventricular septum and the left ventricular free wall. This structural reversal is a form of reverse remodeling, indicating that the heart muscle is becoming less thickened in systole. However, the reversal process was not immediate or complete across all cardiac parameters studied. Despite the significant reduction in fat mass, metrics related to diastolic function, impaired relaxation, heart rate, or heart rate variability did not show statistically significant improvement following weight loss in this cohort. This suggests that residual stiffness or other pathological changes linked to diastolic dysfunction might persist and potentially require a longer follow-up period post-weight loss to resolve fully. Furthermore, the mildly elevated systolic blood pressure observed at baseline often did not decrease significantly after weight loss in these dogs, supporting the theory that the initial high blood pressure readings were related to situational stress rather than being a direct, reversible consequence of obesity itself. New horizons in obesity treatment. Beyond traditional methods, pharmacological approaches are being explored for managing canine obesity, mirroring innovations in human health. A new area of research involves drugs that inhibit the sodium-glucose cotransporter 2, referred to as SGLT2 inhibitors. This class of drug is widely used to manage type 2 diabetes in people. It works by blocking a transporter protein in the kidneys responsible for reabsorbing glucose, thereby promoting the excretion of glucose and the calories it contains into the urine. One such drug, DWP-6001, was tested on naturally obese dogs, defined as having a body condition score of 7 or more. The study confirmed the anti-obesity effects of the drug and its safety. Efficacy. The lowest dose tested, 0.2 milligrams per kilogram per day, led to significant reductions in body condition score, body weight, and fat thickness over an 8-week period compared to the control group. Mechanism. As expected, the treatment resulted in reduced blood glucose concentration and significantly increased urinary glucose excretion. This glucose loss prompts lipid mobilization, contributing to the reduction in fat mass and body weight. Unique advantage. A key finding was that the weight reduction occurred without negatively affecting the dog's food consumption. In fact, Food intake either remained consistent or increased slightly in the most effective dose group, possibly as a natural physiological compensation for the glucose, calories, being lost in the urine. This lack of long-term appetite suppression differentiates it from many other weight loss medications and is highly desirable in managing weight. Systemic benefits. The drug also appeared to positively influence obesity-induced pathological disorders, showing reductions in serum markers often associated with fatty liver and hyperlipidemia, such as alanine aminotransferase, alkaline phosphatase, creatine phosphokinase, cholesterol, and triglycerides. These results suggest that DWP-6001 is safe and holds promise as a novel anti-obesity agent for dogs, offering a tool to help manage this pervasive disease. The future. A collaborative One Health approach. Obesity is often characterized as a wicked problem, a complex, entrenched issue with no single, easy solution, involving multiple stakeholders and diverse perspectives. Tackling canine and human obesity simultaneously through the One Health lens can foster innovative strategies that encourage healthy behaviors for both people and their animal companions, emphasizing the need to eat better and move more. Currently, cross-species data, information directly linking the health of a pet to its owner or household environment, remains sparse. To move beyond merely describing parallel problems, researchers propose concrete steps to correlate health outcomes between cohabiting people and animals. These proposals include integrating simple questions, perhaps 1 to 3 questions, about pet companionship and health into ongoing, nationally representative datasets designed for human health studies. Another approach suggests developing primary data collection sites, such as veterinary clinics or pet adoption centers, where both people and their animal companions could be recruited, basic health information collected, and then followed over time. Such initiatives would provide the crucial data needed to improve health outcomes simultaneously for both pets and their families. In conclusion, the immense body of research highlights that canine obesity is a devastating, widespread health crisis driven by powerful genetic predispositions and complex environmental factors related intimately to the human-animal bond. We have uncovered the deep, systemic impacts of this condition, from the newly defined obesity-related metabolic dysfunction characterized by hormonal imbalances like hyperinsulinemia and hypoadiponectinemia, to significant cardiac remodeling and a heightened risk for diverse diseases including orthopedic issues, pancreatitis, and certain cancers. The fascinating genetic discoveries, such as the role of the D and ND1B gene, demonstrate exactly how genetic susceptibility manifests as increased appetite, while simultaneously proving that strategic human intervention can successfully mitigate these genetic risks. Moreover, the efficacy of traditional weight loss programs, leading to significant reversals in metabolic and cardiovascular pathology, provides a strong basis for veterinary intervention. New pharmacological avenues, such as SGLT2 inhibitors, offer additional tools for management. Addressing this pervasive problem demands a collaborative, multifaceted One Health approach, acknowledging the symbiotic relationship between people and their pets to ensure a healthier future for all members of the household. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.